Most people over 55 are doing the wrong thing for their shoulders. Not the wrong exercise, the wrong approach entirely. And the medical system is not telling them this. There are over 26 million Americans dealing with chronic shoulder pain right now. A study published in the Journal of Shoulder and Elbow Surgery found that shoulder disorders are the third most common musculoskeletal complaint in adults over 55, right behind back and knee pain. And the majority of those people are either being prescribed anti-inflammatories they'll be on for the rest of their lives, or they're being told the same generic advice: rest, ice, maybe some stretching. That advice is not wrong. It's just incomplete. And for people over 60, incompleteness becomes dangerous. My name is Dr. Shigeaki Hinohara. I've spent 38 years practicing orthopedic medicine. The last 22 of them focused almost entirely on age-related musculoskeletal decline in adults over 55. I trained in both Japan and the United States, and I've spent the better part of 3 decades studying why certain elderly populations, particularly in rural Japan, maintain functional, pain-free shoulders well into their 80s and 90s, while the majority of their Western counterparts cannot lift a grocery bag without wincing. I started making these videos because of a patient, a 71-year-old retired school teacher named Haruko. She came to me after 2 years of shoulder pain so severe she had stopped sleeping in her own bed. She was sleeping in a recliner, the only position where the pain was bearable. Her own children didn't know how bad it had gotten. She hadn't told them. She didn't want to be a burden. What I found when I examined her was not what her previous doctors had focused on. They had treated her rotator cuff like it existed in isolation, like the shoulder was a closed system. What I saw was something different, something that changed how I practice, and honestly, something that keeps me up at night when I think about how many people are suffering unnecessarily because we're looking at the wrong thing. I'll get to Haruko in a moment, because what happened with her is exactly why I need you to understand what I'm about to show you. Here's the first thing most people get completely wrong about shoulder pain in their 60s and beyond. They assume the pain is in the shoulder. It isn't, not entirely. What you feel in the joint is often the last stop on a very long road. The real problem, in a majority of chronic shoulder cases I see in older adults, starts not in the rotator cuff. It starts in the subscapularis, the deepest of the 4 rotator cuff muscles, the one you've almost certainly never heard mentioned. I always explain it to patients this way. Think of the rotator cuff like a team of 4 workers holding a door in place. Most people only know about 3 of them. The subscapularis is the 4th worker, the strongest one, and he's been quietly carrying more than his share for years. By the time you feel pain, he's exhausted, and the other 3 can't compensate anymore. A 2019 study in the American Journal of Sports Medicine found that subscapularis tears are present in approximately 43% of full-thickness rotator cuff tears, yet they're routinely missed on standard MRI reads because they require a specific positioning protocol most imaging centers don't use. 43%, nearly half, missed. What this means for you practically, if you've been doing external rotation exercises, the classic rubber band exercises your physical therapist gave you, but your pain isn't improving, this might be exactly why. You are strengthening 3 out of 4 workers and leaving the most burdened one untouched. The first thing you can do tonight is this. Place your right hand flat against your left shoulder, fingers toward your spine. Now slowly try to rotate your left arm inward against mild resistance. If you feel anything other than mild muscle engagement, if there's a deep ache, a catching sensation, or a specific pinch at the front of the shoulder, pay close attention to what comes next. That is a signal worth investigating. Now here's where it starts to get more serious. When the subscapularis is compromised, the shoulder compensates. The body is extraordinarily good at compensating, almost too good, because it compensates silently, without telling you, for months, sometimes years, before the pain becomes undeniable. What happens is this. The scapula, the shoulder blade, begins to tilt forward. It's a small movement. You'd never notice it in the mirror. But over time, that slight forward tilt narrows the subacromial space, the gap between the top of your arm bone and the arch of the shoulder, by as much as 50%. Think of it like slowly closing a sliding door that a cable runs through. At first, the cable still moves, then it starts to fray. Then one day, you reach for something on a shelf and something tears. The British Journal of Sports Medicine published a landmark study tracking 1,200 adults over 60 for a period of 5 years. The finding was striking. Those with even mild forward scapular tilt at baseline were 3.4 times more likely to develop clinically significant rotator cuff pathology within that 5-year window. 3.4 times more likely. And virtually no one is being screened for this. Here's the moment I want you to notice for yourself. When does your shoulder feel the worst? I'm going to guess it isn't during the day, when you're moving, when there's something to do and somewhere to be. I'm going to guess it's at night. When you lie down, when the house gets quiet, and the pain that was waiting patiently all day finally has your full attention. That deep ache that moves from the shoulder down the outside of the arm, sometimes into the elbow, sometimes into the hand. That radiation pattern tells me something very specific, and if you're experiencing it, type yes in the comments right now. Because I want to understand how many of you are dealing with this every single night without knowing what's actually causing it. Now I want you to lean in for a moment because this next piece is the one I almost never see in any patient education material. I've never seen it in a brochure. I've given interviews for major publications and they've cut it every time, probably because it's too nuanced for a headline. Here it is. In populations over 60, shoulder pain is frequently a postural problem masquerading as a joint problem, and we are treating the joint while the posture goes completely unaddressed. Specifically, thoracic kyphosis, that rounding of the upper back that most people chalk up to aging, directly drives shoulder impingement in older adults by mechanically reducing the shoulder's range of motion before the arm even lifts above 90 degrees. I always tell patients this. Imagine you're trying to open a window that's stuck in its frame. You can put as much force as you want into the lift, but if the frame itself is warped, the window is never going to open properly. That's your upper back. That's your thoracic spine. And every year after 60, without intentional intervention, that curve deepens by a measurable degree. A 2021 review in Spine analyzed data from over 4,000 adults over the age of 65 and found that each 10-degree increase in thoracic kyphosis angle was associated with a 23% increase in reported shoulder dysfunction, not correlated with, associated with. There is a direct structural, measurable relationship. And the correction, the one intervention that addresses both the spinal mechanics and the shoulder simultaneously, is not a stretch. It's not a foam roller routine. It's something much simpler and much older. This is where I want to tell you about what I found in Japan. When I spent time in the Nagano prefecture in the mid-1990s, I was struck by something I couldn't immediately explain. The elderly population there, people in their 70s, 80s, even into their 90s, had a range of shoulder motion that I was not seeing in my American patients in the same age group. Not just slightly better, significantly better, and pain rates were dramatically lower. I started asking questions. What I found was not a supplement, not a diet, not a medication, it was a movement. Specifically, a daily practice of scapular retraction combined with deep thoracic extension, a movement pattern embedded in traditional Japanese daily life that most people in that culture perform instinctively as part of sitting, bowing, and manual work. Posture as a default, not as an effort. When I broke this movement down biomechanically, what it does is remarkable. In a single motion, it decompresses the subacromial space, activates the lower trapezius and subscapularis simultaneously, restores thoracic extension, and gently mobilizes the acromioclavicular joint, the small joint at the very top of the shoulder that stiffens faster than any other structure in the aging body. The exercise itself takes less than 4 minutes. You can do it seated. You do not need equipment. And the research supporting its underlying mechanics is not fringe. It is solid, peer-reviewed, and replicated. Here's exactly how to do it. Sit at the edge of your chair, both feet flat on the floor. Let your hands rest on your thighs. Take a full breath in, and as you exhale slowly, draw your shoulder blades together and slightly downward, not up toward your ears, down toward your back pockets. Hold that position for 3 seconds. At the same time, allow your chin to lift slightly, not forced, just released, and let your chest open forward. Your lower back should feel long, not compressed. Then release completely and let your body return to neutral. That's 1 repetition, 10 repetitions, twice a day, morning after you wake up and evening before bed. What happens physiologically over 4 to 6 weeks is this. The lower trapezius, one of the most under-recruited muscles in adults with chronic shoulder pain, begins to reactivate. The thoracic extensors lengthen. The subacromial space, which imaging studies show narrows progressively with kyphosis, begins to recover measurable clearance, and the shoulder stops firing in compensation. A 2020 randomized controlled trial published in the Journal of Physical Therapy Science tested a similar scapular stabilization protocol in adults over 60 with chronic shoulder impingement. After 8 weeks, participants showed a 47% reduction in pain scores and a 31% improvement in shoulder abduction range of motion compared to the control group who performed standard rotator cuff strengthening alone, 47% in 8 weeks, with no medication, no surgery, no clinic visit required. But I want to come back to Haruko, because here's what her previous doctors had missed. And I say this not to criticize them, but because I think it matters. When I evaluated her posture, her thoracic kyphosis angle measured 58 degrees. Normal for her age is considered up to 40. She had been rounding forward for years, decades actually, from a lifetime of desk work, and then from the posture of grief after her husband passed. Nobody had measured it. Nobody had connected it to her shoulder. She was sleeping in a recliner. 2 years, 62 pounds lighter than she'd been 5 years before, because cooking had become painful and eating had stopped feeling worth the effort. I put her on a modified version of this exercise 3 times a day, gentler range, with additional thoracic support initially. Within 3 weeks, she called my office. She had slept in her bed for the first time in 26 months. I'm not telling you this to promise you a miracle. Bodies are complex, and every case is different. What I'm telling you is that this woman's suffering was not inevitable. It was structural, it was addressable, and it went unaddressed for 2 years because no one was looking at the whole picture. Now here's what I need you to understand about the morning. The exercise I've just described works best when the body is warm. So if you wake up with significant stiffness, do not start with the full movement. Start with 5 minutes of gentle shoulder rolls first. The goal is blood flow before load. Cold tissue and forced retraction are counterproductive, and I've seen patients give up on good interventions because they rushed them before their body was ready. The ideal timing is this: wake, 5 minutes of gentle movement, then the scapular retraction sequence. In the evening, perform it 30 minutes before you lie down, not immediately before sleep, because the muscular activation will elevate alertness slightly. 30 minutes gives the nervous system time to downregulate. If you have already been diagnosed with a rotator cuff tear, partial or full, do not attempt this exercise without first discussing it with your physician or physical therapist. A tear changes the biomechanics, and what helps an intact shoulder can sometimes aggravate a compromised one. I want to be honest with you about that. This is not a replacement for medical evaluation, it is a complement to it. I want to ask you something directly. Have you been managing shoulder pain for more than 3 months and assumed it was just part of getting older? That it was something you'd have to live with? That the best you could do was be careful, take it slow, and not reach too high? Because that assumption, that one quiet, resigned assumption, is responsible for more unnecessary suffering than almost anything else I encounter in my work. The body, even at 70 and 80, has a remarkable capacity to adapt and recover when you give it the right input. The shoulder is not a fixed system. It is not a machine with a limited lifespan. It is tissue, and tissue responds. If this is resonating with you, if you recognize your own experience in what I've described, I want you to share this video with someone you care about, not because of the channel. Because there is genuinely someone in your life who is sleeping badly, moving less, doing less, living smaller, because of something that can be addressed. You might be giving them something they didn't know they needed. The last thing I want to say, and I mean this as directly as I know how to say it, don't wait until the pain is severe to take it seriously. In my 38 years, the patients who recover most fully are never the ones who waited. They are the ones who acted when the signs were still mild, when the stiffness was just stiffness, when reaching overhead was just uncomfortable, not impossible. The exercise I've described is free. It takes 4 minutes. It has no side effects. And the science behind it, the genuine, published, replicated science, supports it clearly. Do it tonight, not tomorrow. Tonight, before you lie down, sit at the edge of your bed, draw those shoulder blades together and down, lift your chest, breathe. That's where Haruko started. In a recliner she finally got to leave behind. You deserve to sleep in your own bed.